Good morning, everybody. Welcome to the Hear from Peers webinar series for the fall 2025, where we can hear how our faculty using generative AI within the classroom. And hopefully there will be a good discussion place or some talk about how we can integrate generative AI within our classroom. And this morning we have Dr. Marnas Tamasbi. Hopefully I spell it correctly, from College of Dentistry. She is a clinical assistant professor, and I will let her to introduce herself, and she can start her presentation.
Sure. Hi, everyone. I am Mernas Tamasbi, and I'm a maxillofacial radiologist. I teach radiology to dental students, dental hygiene students at College of Dentistry. And so our school is located in Dallas, and it's been about, I think, 7 years, 6 or 7 years I am teaching radiology to our students. So that's basically about me. And for my presentation, which is integrating AI into radiology education for dental students. So basically, this presentation explores the application of the artificial intelligence in teaching radiology to our students. For this exercise, I asked dental students, the fourth-year dental students, to participate. The reason is that they already had their own didactic sessions in radiology, and they had experience in the radiology clinic taking radiographs, and then they are ready to graduate. So, and the students that participated, they already graduated. Okay, so why I chose this topic is that, as we know, AI is growing rapidly and fast in every field, in medical field, dental field, and as well as the radiology field. And when in radiology, when we take the radiographs, we have to look at the images. We need to find the findings, the region of the interest, and provide a radiographic interpretation, meaning that we provide the note about the findings, if there's any lesion, if there's any caries, so on and so forth. And then we provide the proper management for the referral, or if the dentist is looking at the image. So the whole thing, we call it as a radiographic interpretation. So that's what we teach to the students and make them ready when they're on their own, when they're in the practice. So with emerging AI into dental field, specifically in the radiology, dentists are using AI interpretation to look at the radiographs to tell them, hey, what are the findings? If there is anything, if there's any incidental findings, or if there's anything that they have to pay attention. So that's why I think it's important for our students to actually experience and using AI when they look at their radiographs. And this experience will help them and also help us to see what AI can do, where it is helpful, and where we still need to rely on our own judgment when you look at the radiographs. So for this exercise, I prepared two cases, two radiographs, different types of images. And with the clinical scenario, I gave these two cases to our students. And then I asked them to first look at the image, provide the describe the lesion. So that's what we do. When we have a lesion, we describe it, how it looks like, and then provide the proper differential diagnosis, what could be this lesion. And then lastly ask what is the best management. So when there is a lesion, what is next? What should I do? Do I refer to the specialist? Do I do the biopsy? Do I ask for the advanced imaging? Should I do the treatment right away? So on and so forth. And then when the students done all this process, I asked them to put the images, these two cases in ChatGPT AI, and ask ChatGPT the same thing. So I also use those cases from the published articles. So um, I didn't, so at the first, I didn't tell the students what is the lesion. When the students upload the cases into AI and then read this AI findings, then I share the diagnosis with them. So the student could compare their results with the AI result. So for the first case, this image is the panoramic radiograph. I don't know how much you're familiar with. If you maybe you have one of these panel images on your own when you went to the dental clinic. So it gives the bigger image of the jaws. This is the maxilla, this is the mandible, and there's a lesion over here. So the reason I gave this case is that this lesion is very straightforward. It has a very straightforward findings. It's easy to find. It is easy to detect and describe, and we usually give this type of cases and lesions to our the first year dental students because these are like easy to start with. So and after that, when the students done their own writing, they asked AI, and then after that, the students found that their answers are very close to whatever AI told them. And then this is an example of the benign lesion, and both the students and AI reached to a benign diagnosis for this case and provide a proper management for the benign lesion. For the second case, this is a periapical radiograph, and this one is a little bit more challenging. It's not as straightforward as the first one. It has a challenging features because the borders are not as easily detectable when compared with the previous ones. So AIs for this, so this is the case of the malignancy. However, AI described this case as a benign lesion and provided differential diagnosis of a benign lesion. So most of the students were surprised and about this one. And after that, I asked them to fill out the survey for me and asked them how helpful did you find AI case descriptions. And most of them, they said they were moderate. It was moderately helpful. And I think it's because of the second case, they were not that happy. And asked them how accurate do you think ChatGPT's differential diagnosis was. And then they, again, moderately helpful. And most of them, they answered moderately helpful. And then I asked them how useful did you find ChatGPT suggest case management? Again, most of them, they say it was moderately helpful. And would you use ChatGPT to generate differential diagnosis in your practice when you're on your own? Most of them, they said yes. And are you going to completely rely on ChatGPT for clinical decision making? And I'm glad most of them, they said no at this point. So I lastly asked them, do you believe using ChatGPT or AI could enhance patient care in your practice? Majority said yes. So after that, I have like a discussion with the students. So we came to this conclusion that AI, based on this practice, it's not a perfect, it wasn't a perfect practice, of course, but based on this experience, we feel that AI perform well with the common lesions that they have like straightforward appearance. However, it struggle with the ill-defined lesions, rare lesions, or aggressive ptosis. So we know that like we feel that quickly AI can quickly analyze a lot of images, thousands of images. It supports the screening and large workflow. If it's for like a offices that they have many patients in hospitals, in dental schools. However, there's a bias performance depends on training data. Rare cases may be underrepresented to the AI. And but we can use it as an adjunct tool. It can flag areas of concern, improve diagnostic consistency, and help in education. But at this point, it cannot be replaced by the clinician's clinical judgment. So we all feel that this AI is a good supplement tool for to use in the practice, but it cannot be replaced totally. It cannot replace the human at this point. It needs the learning process, and AI is growing rapidly. Like as I think as I'm talking right now, I'm pretty sure it is. If I give that a second case to the chat GPT, I have the feeling it can give me differential diagnosis of the malignancy. Yeah, after this presentation, we all felt that at this point, it's better not to rely on it completely, but it's a good tool to use as an adjunct. And that was basically my exercise and experience.
All right. Thank you for your presentation, Marnaz.